What does a car exhaust system have in common with the cardiovascular system? Pipes, vents, and a pump. And beat vascular health. We are developing a tool to help identify and locate anomalies in the cardiovascular system, based on models and software originally created for the car industry. In Sweden, 30,000 patients each year are being admitted due to intermediate risk of acute coronary syndrome, a potentially deadly condition. But in the end, only 6,000 of these patients are actually found to be at risk. The other 24,000 are being overadmitted, leading to unnecessary healthcare expenditure, healthcare workload, and patient stress. And this is a global problem. Overadmission happens partly because the current diagnostics tests are not precise enough to support an accurate risk assessment. And without being able to dismiss the risk of acute coronary syndrome in the patient, the physician will admit the patient, since the consequences of not doing so could be devastating. The obvious way to tackle this problem would be to implement a tool that can support a more accurate risk assessment early in the cardiac care process. With this, researchers and clinicians estimate that the number of overadmitted patients could be reduced by up to 50%. In addition to this, they would need this tool to be able to provide results quickly, be accessible and easy to use, so that it can be implemented in most healthcare settings without the need for highly skilled operators. Based on research from the Royal Institute of Technology and models and software originally developed for the car industry combined with machine learning, we are on our way to create such a tool. We are using a non-invasive multi-sensor setup to retrieve data from the patient's cardiovascular system. The data is fed into our software where it's analyzed to identify and locate anomalies. And the results can then be used as decision support for risk assessment, either to dismiss or confirm certain conditions related to the patient's cardiovascular system. Our initial customers will be cardiac clinics and cardiac hospitals, and later on large healthcare providers, and our tool will be used at the emergency room and in the cardiac care process. To estimate the value of our market, a relevant comparison is the market size for resting ECG, which is normally used for similar purposes and in the same settings as our tool will be used. Currently, we are working on developing a proof of concept and collaborating with researchers and clinicians to verify our software. And our plan is to start the development of the complete tool in 2023. And to achieve this, we have a team of highly skilled persons, leading experts from the relevant technical and clinical areas, as well as business developers with extensive experience from building and running life science companies. Overadmission is not the only application where our tool could be of use. Our vision is to create a tool that can be used in screening for early signs of cardiovascular disease, which is the most common cause of death globally, with huge consequences, both in human as well as economic terms. Our tool could be used to find precursors to cardiovascular disease, enabling the possibility to intervene at an early stage and reduce the risk of cardiovascular disease occurring. Thank you for listening, and please reach out to us if you have any questions or want to discuss possible collaboration or investment opportunities. Thank you.
Thank you so much for a great presentation. Pontus, could you just please join me and let's talk a little bit?
Thank you.
So I'm eager to know, how did you figure out to use technical methods developed for automotive industries and engineering, but for cardiovascular analysis?
Mikael Karlsson, who is my colleague, was the inventor of our tool, and he was a researcher working with pump and pipe systems and optimization problems for these. And at that time, a couple of years ago, it was very many researchers were looking at actually modeling the human body and using other models and so on. So he got interested in trying modeling the cardiovascular system, and he thought there were quite a few similarities between a pump and the pipes in a car and the cardiovascular system in the human body.
Wow, that's so impressive.
Thank you.
I happen to know that you and Mikael, you're old friends.
Yeah.
But how come that a researcher and you with the med tech business development background, when did you realize that you wanted to start a company together?
Actually, it was a party after a couple of beers, only a few, and I think Mikael had thought about this idea for a couple of years before talking to me, and we were both at the point in our lives where we had some spare time to interest ourselves in other things. So he described the idea for me. At the moment, I think I didn't understand anything about what he was trying to say, more than I understood that it was a medical device, which is my profession. So I said, okay, let's go. And a couple of months later, we started a company.
That's wonderful. So, but why did you choose to enter the Chalmers Ventures Accelerator program?
Yeah, actually, I knew some people here at Chalmers Ventures and had heard a lot of good about the Accelerator program. And I also had we had a project in my old company together with Chalmers Ventures many years ago. But then I think it seemed like a very good place to start a business and get all the help you need to structure your business and go forward in a good way.
That's great to hear. And we're so pleased to have Beat Vascular Health and you, Pontus and Mikael, on board, and we look forward to the journey together. And for everyone watching, thank you so much for taking the time to watch us meet our new startups. I'm sure we'll see you soon again.